Hi, everybody. Today I am joined by Dr. Wendy Chen. She's one of my classmates in med school. She will discuss with us regarding plastic surgery. She's currently finishing up plastic surgery and going to fellowship, and I'll have her discuss more about it. All right, welcome, Wendy. Thank you for your time.
Hi.
All right. Can you tell us the route that you took to get to become where you are right now, and also discuss your future plans as well?
Yeah, sure. So I went to college at UCLA,
Hmm.
and I think that's where it starts. So I did not have a super stellar GPA.
Yep.
So what I ended up doing was I did the Georgetown Special Masters program in Washington, D.C., and that really helped me, I think.
Hmm.
So I did that. I did a year of research at the National Institutes of Health, and then I got into Cincinnati Medical School where we met.
Hmm.
And for a long time, I thought I was going to work with kids, and I had gotten a minor in public health when I was in college.
Hmm.
And I think step one as a student, we all decide, do we want the surgery life, or does surgery interest us or not? Um,
Hmm.
and I think that's the number one decision to make first. And so
Okay.
once I identified myself as interested in surgery, I thought, okay, I'm interested in kids, I'm interested in surgery, so pediatric surgery. And I did summer research in a fetal surgery lab. Um, and then I got a mentor who is a pediatric surgeon. And then I got started on my surgical rotations. And the first surgical rotation I was on was plastic surgery. And so actually, then I got very intrigued because I don't think I really had a good idea of all the types of surgeons and surgeries that exist. And
Hmm.
plastic surgery just really captivated me. And we can get into that a little bit later. But then, once I had identified such a challenging, competitive subspecialty of surgery, then I just tried to figure out exactly what it is that I needed to do. I had mentors who were, junior residents, senior residents,
Hmm.
fellows, and attendings. And I think that ladder of mentorship was really helpful because that way I could get different people's perspectives, as well as kind of fielding stupid questions first with the
Yeah.
junior residents and then working myself up. So to get into plastic surgery, away rotations are really important. Kind of networking a little bit and getting really good letters of rec from kind of names that are a little better known is
Hmm.
important. Board score is obviously very important, your USMLE step one. And also AOA is kind of important, I'd say, because
Hmm.
with one item on your CV, you demonstrate how well you've been doing overall as well as clinically. Um, I'd say that kind of summarizes what it takes to get into plastic surgery.
Yeah, yeah, it's a very competitive field for sure. You're at a combined program, but there are not combined programs as well, correct? Or am I wrong?
Yeah, so there's two ways to get into plastic surgery. One is directly out of medical school. That's called the
Hmm.
integrated program. In the past, they had kind of combined programs where you are kind of owned by general surgery for the first few years, and then you become owned by plastic surgery, so to speak,
Hmm.
in your last few years. But nowadays, I think mostly they're transitioning to integrated. And so you do maybe a year of general surgery sprinkled over the course of 2 years, plus other things like a little bit of orthopedics, a little bit of neurosurgery, a little bit of this and that, ICU, for example, and then the majority of your training is in plastic surgery. Um, and then the other way to get in is having completed a different residency. Most commonly, that's general surgery. And
Hmm.
so you apply maybe 3-4 years in, or 18 months before you want to start your plastic surgery training. Historically, in the past, people have come from ENT, OMFS, orthopedic surgery even, and but mostly now it's general surgeons. And then you finish 3 years. It's kind of like a fellowship. And then everybody can then pursue further fellowships after you finish your plastic surgery training.
So the range is around how many years could possibly?
Yeah. So if your general surgery program is 5 years, then it's 5 plus 3. If it's 7 years, then it's 7 plus 3. If you're an integrated resident, it's usually 6. If you do a year of research, like I did, or maybe even more, then that's you're going to 7 years, 8 years, 9 years. One of our residents is choosing to do, I think, a 2 or 3 year research stint in the middle of residency. So that'll kind of, it starts adding up.
Yeah. It's definitely a long road. And can you tell us your decisions in choosing what type of fellowships there are, or the one you chose, and what other fellowships are available?
So when you finish plastic surgery, you can do pediatric fellowship. Most commonly, that's craniofacial, what people usually think of, like cleft lips, cleft palates, craniosynostosis, where maybe there's pressure building up in the brain due to premature fusion of the bones in the skull. But also vascular malformations, more soft tissue things. So there can be hemifacial microsomia, microtia, anotia, various congenital anomalies. And so there's a bony portion and a soft tissue portion. There's also congenital hand. People born with fused fingers, too many fingers, misshapen fingers, or hands, including the forearm. And so there are most fellowships, kind of depends on your catchment area and who else is sharing that burden. So ENTs can also do cleft lip, cleft palate, so can OMFS. And so every fellowship, I think, is a little bit different. And so people kind of gravitate to how much soft tissue they want to do, how much of this, like maybe they want to reconstruct ears or hands. And then another fellowship is microsurgery. Microsurgery is mainly sort of 2 camps, but in every fellowship you can kind of see how much of one or the other is included. One of them is head and neck reconstruction, so oral cancers, things like that, where you have to reconstruct a jaw, a midface, part of the orbit, or any other part of the head and neck, as well as second big part is breast reconstruction. So breast reconstruction is kind of a job that's really in high demand, so microsurgical breast reconstruction. Another fellowship that you can do is hand. So that includes both hand trauma, like mangled hands, or reconstruction after traumas or oncologic resections, but also elective hand. So that can be various types of arthritis for various different reasons. I would say elective hand also includes rheumatoid disease, and anything that comes up. And depending on your background, so I probably won't be doing very much shoulder work. That's very orthopedic, but elbows kind of in there as well. So some fellowships will take care of everything from the shoulder all the way to the fingertips. And for plastic surgeons, it's harder to catch up to that. I think if you can take care of the whole forearm and maybe even some of the elbow, that's pretty good. And then one of the newest fellowships that are very few is transgender and gender affirming surgery. So that's quite new, but there's been higher demand sort of interest-wise from patients and from surgeons wanting to offer. That can include facial feminization or maybe masculinization even. Top surgery involves making breasts from implants or creating a more masculinized looking chest. And then bottom surgery is when you try to reconstruct the genitalia to match the gender identity. So I'd say 3 of the most traditional fellowships, and then maybe this new one is an upcoming 4th. Pediatric hand is another kind of 6-month thing. So usually people do a full hand fellowship and then dedicate 6 months afterwards to do pediatric hand as a sub specialty.
It's quite a breadth of
Yeah.
variety there. I personally did not know all this stuff
Yeah.
before talking to you. Just moving on from like the student's perspective, what characteristics or qualities you think make for a successful plastic surgeon?
Yeah. So, I mean, I think there's the doctoring part,
Mm-hmm.
and some people sometimes call plastic surgeon psychiatry with a knife.
Mm-hmm.
And I think so. I think you have to have very good emotional quotient. You know, if you're talking about cosmetic surgery, I forgot that. That's also a fellowship. So cosmetic
Yeah,
surgery is the next
yeah,
fellowship.
yeah. Yes,
Okay.
big one.
So you gotta add that in there. Um, so um, so I would say emotional quotient. So everything from choosing who to operate on because you develop a lifelong relationship with that person potentially,
Mm-hmm.
as well as people get very, um, the face and the hands are very uniquely human, you know?
Mm-hmm.
Um,
Yes.
your hands, they do things like generate an income for your family. They allow you to do hobbies. Nowadays, with the internet and with texting and the phones and things, hands allow you to be social. You know, in some cultures, not missing a finger or something is a real problem. And
Mm-hmm.
so hands, I think people take really personally. And of course, the thumb is something that's very uniquely human, an opposable thumb. The face, there was an ENT lecture that I saw once, and it was like, the face is very unique. Can you imagine yourself having a relationship with somebody, a true, intimate, meaningful, in-depth relationship with somebody with zero face? A face that doesn't animate, that doesn't have any facial expression, that can't create emotion, feedback, communication. And so those are all reasons why we reconstruct the face. Secondarily, if you think of everything that we've been doing throughout COVID and the social isolation, socialization is really important for animals and for humans. But I think especially for humans, you know, kids going crazy because they're not getting enough socialization, or people, you know,
Mm-hmm.
out there protesting because they can't socialize with people. So I think socialization is really important, and the face and the hands are really important tools to socialize and relate to other humans. Um, so emotional quotient and figuring out what exactly patients are bothered by and what exactly their goals are. Sometimes you have to draw it out of them, and maybe they can't articulate it so well themselves without your help.
Mm-hmm.
And then I think secondarily is the technical parts of doing operations. So um, I think plastic surgeons are perfectionists as well as artists, as well as technicians. So people who have a high standard for themselves in all of those regards, I think are suited for this. And then I think for anything, ethics, because there can always be some gray zones, but particularly in plastic surgery, I think you can find yourself in some gray zones sometimes because
Mm-hmm.
there's this service component, you know, like when you're in private practice doing cosmetic surgery, you're running a business. And
Yep.
so in all ways, ethics. And then one of the last things, I think, plastic surgeons work with everybody in the hospital usually. So when we do reconstruction for neurosurgery, when we do reconstruction for colorectal surgery, when we do reconstruction for urogenital surgery, when we do reconstruction for breast oncology. So you have to be somebody who can build and maintain and have really collegial, collaborative relationships with other doctors in the hospital. So I'd say those are probably some of the tops.
What is the most exciting things you find about plastic surgery?
Um, so I think, you know, when each of us thinks, so you and I knew each other 7, 8 years ago,
Mm-hmm.
12 years ago until 8 years ago. And
Yeah.
when you look back on that time and where we started as first year medical students, you can really feel the delta and the change that has occurred over the course of a decade. So I think when you encounter a patient and at time zero, when you encounter a patient at time zero, and then you encounter them again a year or 5 years later, if you've done a breast reconstruction for them, a nerve reconstruction, hand reconstruction, and you see where they started, which may have been really worried, afraid, they lost something, and you get them to a point where they are leading a really happy, productive life,
Mm-hmm.
in part due to the intervention that you did. I think that's really satisfying. So things that have to do with people's function and quality of life, I think, are the most satisfying parts of plastic surgery.
Yeah. What do you think you'll dislike the most about plastic surgery?
So dislike the most.
Mm-hmm.
I think challenging problems that don't have a good solution, but you are still there to help the patient, are challenging. So you establish a relationship, but when your tools and your armamentarium are limited, that's really hard. So sometimes, people joke that we take care of a lot of wounds in the hospital and we're the wound doctors in the hospital. Some wounds are, as people call them, butt wounds. So like pressure ulcers on the backside, and
Yeah.
be really big or kind of gross or smelly. And that can come from all around the body for any reason, from smoking, from diabetes, from autoimmune disease. It can occur on extremities, on feet for diabetics. It can occur in wounds in the belly for whatever reason. So when you don't have a great solution for somebody, but you're there for them and you feel like your hands are tied behind your back. So I think as an attending, I would add the component of billing and improving your patient's access to care.
Mm-hmm.
So access to you, access to getting something paid for. That I think is probably the most frustrating. The bureaucracy of medicine, I think, is probably the worst. I had a patient, she was old, she had a little hernia, and because plastic surgeons do abdominal wall reconstruction, and she thought, I'm almost 65, I'm gonna wait. I'm gonna wait because her private insurance didn't cover it, or some, I don't know, but she waited, and all of her intestines kind of started coming out into this hernia. And by the time she came to see somebody, she had lost a lot of domain in her abdomen, and
Yeah.
reconstructing her was going to be so much greater risk, greater challenge.
Mm-hmm.
And that just really, obviously I still remember it like 5 years later, but that
Yeah.
really hurt me to see that that's why she didn't come see the doctor.
Yeah. That's really sad. So how has your specialty changed over the years, and then can you discuss it in light of COVID-19 as well?
Yeah. So, I think plastic surgery over the decades has changed a lot because plastic surgeons, I think, are innovators as a result of the type of people that go into it, as well as the fact that you collaborate with so many people around the hospital. So I think everybody kind of knows that the best ideas come from different things coming together. And because
Mm-hmm.
plastic surgeons are kind of the intersection point of a lot of different things, we are often innovators of that. So for example, wound devices, or new technology for reconstruction, or ideas like, Joseph Murray won the Nobel Prize for coming up with kidney transplants. And who would have thought that the first person to do a kidney transplant was a plastic surgeon?
Mm-hmm.
So that, I think, is one of the interesting things about how plastic surgery has evolved over the years. In light of COVID-19, I would say the ways that we have practiced a little differently. So first of all, I'm in Pennsylvania, I'm in Pittsburgh. And so I think we've been doing pretty decently well with the curve. And so for me, that meant we still do the acute cases like trauma and cancer reconstruction that cannot wait. And then the cosmetic cases and the elective cases just stopped and then are slowly coming back up again. In particular, a consideration was head and neck cases. So that's obviously where, you know, if you're operating on the foot, your risk is lower. But if you're operating right there in the head and the neck, your risk is higher. So I'd say compared to other surgeons, we probably are kind of in the middle or even on the safer side. But I noticed that a lot of private practices were suffering a little bit in terms of, if you're in private practice, you got to keep the lights on. And like, if you do a lot of elective surgery and you don't have immediate demand and urgency from trauma and cancer, then that could be a consideration for, you know, just from a business standpoint.
Gotcha. And how do you see the specialty changing in 10 to 20 years?
That's a great question. So what I think war has always done is create new problems for reconstructive surgeons. So, you know, the idea of skin grafts, and then from the First World War, and then in the, you know, in more modern wars, when medicine in the field has improved, people are coming back alive with harder and harder challenges. So I think that as technology improves and there's new toys, so to speak, then reconstruction becomes a lot more interesting. So that could be, you know, reconstruction of the eyeball and the whole optic unit. That could be prosthetics, better prosthetics that are more easily controlled by what's left in the body. That can be agents that help wounds heal faster. There's still, you know, it's very hard to do any sort of central nervous system nerve reconstruction, or even peripheral nerve reconstruction is not very well figured out. And then, you know, like cartilage and bone healing. So plastic surgeons, I think, uniquely deal with the entire body. So hair, scalp, bones, tendons, nerves, soft tissue, everything down to toes. So I think there's a lot of opportunity, and there's going to be so much still to figure out in terms of reconstruction. And so that's really exciting.
Yeah. So it sounds like the job market will still be in great demand to the current medical students or the pre-meds who want to go in plastic surgery. Is that a fair assessment?
So I think studies have been done to look at plastic surgery from a cosmetic and an elective standpoint and how the economy is doing. But I think for reconstructive surgeons, it will always be sort of like a steady thing. So I think if you're doing reconstruction, you will probably always kind of have a job. We're not so close to the future where people can prevent all types of cancer. You can never prevent people from doing trauma to themselves or each other.
Yeah.
So
I'm acutely aware of that as a ER physician.
Right. So I think that will always be really interesting. The patient, you know, it's like, just like medicine, the patients drive like the problems and help force us to be more creative to create solutions.
Yeah, that's true. Do you work with NPs and PAs, and do you see the responsibilities of NPs and PAs changing in the future?
Yeah, that's also a great question. So I don't think I know any NPs in plastic surgery, but we do have a lot of PAs. And our PAs all have different jobs based on the needs of the practice. but PAs are, for example, definitely in the operating room, because plastic surgery is all over the body and it's not like little ports and scopes usually. Usually it's like big incisions and things. And so PAs help in the operating room. They help with patient care, notes, orders, rounding, consults, even depending on the practice. Some PAs will do Botox injections and Botox and filler injections. You know, some PAs that have been around for a really long time, they teach the junior residents. They also help with like seeing patients in clinic and you know, billing things sometimes. So especially if you aren't associated with the residency, PAs definitely are an integral part of patient care.
Okay. What's the one thing you wish you knew sooner, knowing what you know now?
um,
Or multiple?
well, I mean, I think certainly when I was applying to plastic surgery, I was just so desperate to get in. Like it was so competitive. And I think this is true for everybody who's becoming an attending, but the big scope of medicine. So like sort of the business of medicine and the bureaucracy and the politics and how insurance works and all these things. And so, I mean, I think learning how medicine as a system works is really important education that students and trainees often don't really get unless you seek it out. So I think that's one. Other things that I wish I knew, I would say it's really hard for a student to really understand the sacrifices, personal, physical, emotional, that it requires to do a surgery residency, reproductive sacrifices, financial sacrifices, because it's more time that you're not making money, even though your earning potential might be higher. So spending as much time as you can really immersing yourself and talking to surgery residents to understand what it really takes. I sometimes tell students, do this only if there's nothing else that you can see yourself doing. Because if you can still accomplish your goals of being a physician in other ways, that might be kinder for you and your family and your life. I don't regret choosing this path, but I think those are important considerations, you know? So I think especially if you're a woman or a minority that's underrepresented in medicine, you must acknowledge that you're going to have additional barriers and challenges. I do research on this topic. And so basically you have to be ready to cope with microaggressions and macroaggressions coming to you from patients, their families, nurses, staff, other residents, attendings, other specialties. And that can really grind on you. It can contribute to your burnout. Yeah. And so that's before you even account for the challenges that you're going to face as a surgery resident, period. Yeah. So, you know, we need more women and minorities in surgery. So I don't want to dissuade people, but I think you need to have a plan early on, chat with people so that you can protect yourself and be prepared how you're going to deal with encountering these things around the hospital.
That's very great advice for those who want to go into physician in general. So would you have done anything differently along this path?
So now that I am graduating, I feel like in the beginning, I felt really small, and I put myself, and I allowed society and expectations to put me into sort of a box
Mm.
of what am I allowed to think or not think? What am I allowed to do or not do? And that really stifled my imagination a little bit in terms of um, let me put it this way. Nowadays I think, well, why not? Why can't I do that? Why can't I be the principal investigator on a project? Why can't I just reach out to people around the country and ask them this question? Why can't I apply for that grant even though I'm a resident?
Yeah.
Why can't I scrub that case if all my work is done? And so I think if I could go back and talk to myself as an intern, I might say, every time you think, oh no, I can't do that. Like I'm not allowed to do that, or I shouldn't do that, or I'm too junior for that, or nobody's ever done that before. I would say like, well, why not? Why can't you be the one? Why can't you be the first? Um, Sometimes people say it's better to apologize later and then to ask for permission first. And,
Mhm.
use that advice with a little grain of salt,
Yeah.
obviously.
Yeah.
Um,
Yeah.
but I think you can open up a lot more opportunities for yourself sometimes when you just think like, well, why not? Is there a real reason why I can't do that? Yeah.
Okay. Those are great tips as well. But do you have a number one tip for students who are interested in doing plastic surgery?
Um, I think um, I think the number one thing to be successful as a physician and a colleague or somebody in the hospital is probably no matter how tired you are or how much other people have kind of beat down on you, to
Mhm.
always treat everybody, but especially your patients, like they are your people and your family. So, when you treat other people, when you treat patients like your family, you force yourself to be the best physician you can be, to be the most up to date, to be the best surgeon in the operating room, to take care of them the most detailed way before and after they get your surgery done. Um, and other doctors will see that, other nurses will see that, the patient will see it, their families will see it, and it will really enrich your human experience.
Mhm.
Secondarily, you will be kind, I think, and patient. And you never know what other people are dealing with, why they might be mean to you, or what exactly is going on in their lives. Um, but by being kind and patient with people and with yourself, I think goes a long way. It establishes your reputation, and it'll just open doors for you around the hospital when things are not going well, when you can't find something, when you need help. People will help you, and people will refer people to you, um, and most importantly, people will remember how you made them feel. And it's about
Yeah.
how you treat everybody, so yeah.
I totally agree with that tip wholeheartedly. All right. Um, and then lastly, for our students who are interested in uh, learning more about plastic surgery, do you have any resources that they can find?
Yeah, I think maybe the first place you should go is the ACAPS website, ACAPS.
Hmm.
It is the Society for Academic Plastic Surgeons. It's how you apply for residency. It's how you find out all the programs in the country.
Hmm.
Another website is ASPS. That's our National Society of Plastic Surgeons. So you can
Hmm.
find plastic surgeons anywhere in your region.
Hmm.
Uh, if you don't have a program at your country, your program, if you don't have a plastic surgery department or division in your medical school, you can just find maybe somebody in your community that's willing to have you shadow or observe or learn what plastic surgery is all about. I would say actually Instagram is starting to grow, people with sort of educational content Instagrams.
Mm-hmm.
And then the book that we all carry around in our bags as a quick and dirty is called Essentials of Plastic Surgery. It's written by Jeff Janis, who's at Ohio State, Janis. Because as you also mentioned at the beginning of this interview, there are a lot of things that plastic surgeons do that people don't know about. And I'd
Yeah.
say when people think of plastic surgeons, they do not know 95% of what we do.
Yeah.
So I would say those are the starting points. And I'm happy to answer any questions and chat with people. Also, if people find me mainly these days on Instagram, I'm at Dr. Chendy, DRCHENDY.
All right. All right. Thank you, Wendy, for your time and knowledge drop. That was very informative and fun to learn. So, thank you for your time.